Hey, Dr. McManus.
Hey, Dr. O'Connor, what's up?
So we have had a bunch of questions from people recently about stem cells.
Yeah.
So do you think you could fill them in on just some basics? Like, I'm looking at some of the questions they've asked. What the heck are stem cells and why are they so fabulous?
Good questions. So stem cells are a portion of the cells in our bodies. We have a lot of them when we're growing in the mom's womb. And as we age, we have fewer and fewer. They're starting to die off. They don't work as well. They don't multiply for us. And they're sort of the raw materials for the body. So there's different types of stem cells, but they can basically turn into other types of organs, other types of cells like muscle tissue, bones, liver, heart, things like that. And what's awesome about them is they've been studied for decades now, and they've become more and more popular over the years with a wide variety of uses. And so there's different types of stem cells that are used. Some of them come from fat, some of them come from um, umbilical cord tissue. Some people may have heard of embryonic tissue, which is illegal, also having ethical issues. So we don't use that. We can't use that in the United States anyways.
Okay.
Oh, I didn't answer your question about what makes them so awesome. Well, we've seen them used in a lot of different ways over the years. And there's just not enough time in the day to go over all the different testimonials of the benefits that we've seen with stem cells. But the fact that they repair the body, they regenerate tissue, they modulate the immune system, which means they will boost it where it's underactive, and it will dampen it where the immune system might be overactive, and they reduce inflammation.
Very cool. All right, so someone else says, so I heard it might fix my rotor cuff.
Which your rotor cuff?
That's Texan for your rotator cuff, which is in your shoulder. So a lot of people think it's for bones and joints and soft tissue things. So is that true?
Yes. Yes, they are often injected into joints and into soft tissues around tendons and things like that. Maybe somebody has tendonitis, maybe somebody has wounds that aren't healing very well. So stem cells have helped a lot of people avoid surgeries, joint replacements and things like that. Yes, I do want to say that the FDA doesn't like us to use the term stem cell when we're talking to people about them. So we're supposed to instead say if we're using a product from umbilical cord tissue, it's Wharton's jelly, which is a specific part of the umbilical cord that comes from full-term healthy babies. And that Wharton's jelly contains stem cells, but it also contains other important cells for the body and growth factors and chemical messengers and things like that.
Nothing can be bad about jelly, right?
Right.
Okay, so here's the next question. So you did allude to it earlier. It can come from fat. Are they going to suck fat out of my thighs, spin them around, and give me my own stem cells back?
Well, yes, that is one way to do it. That's called autologous fat. So the people on that camp who do that procedure, I would say their main argument is why use somebody else's cells when you can use your own. The people on the Wharton's jelly camp, our argument would be, well, why do an invasive procedure that you don't need to? And why use your old dysfunctional stem cells that aren't working for you anyway, when you can use a baby's stem cells, which are what they say, very robust. They're very potent.
Excellent. Okay, here's the next question. Do I have to fly to Costa Rica to get them?
That is one way to do it. You can go to Costa Rica or Colombia or other areas.
Vacay.
Sure. I've heard nice things about those places. But no, you do not have to do that. Wharton's jelly is available in the United States, and currently the autologous fat is legal in the United States. But the difference between what we can do in the United States versus outside the United States, there are some things. So mainly what we are not allowed to do in the United States is what we call expanding the cells, making them grow, multiply. We can't do that in a laboratory setting, but outside the United States, you can. That doesn't necessarily make it better. So if you say, okay, well, I can get 5 million cells here from umbilical cord tissue or some other source, well, those are first generation, those are good. Well, if you take those stem cells and you start multiplying them in the lab, they become less potent, they might start to mutate, and who knows what else happens to those. But that's what's typically done outside the United States, where they promise you, we're going to give you 1 billion stem cells if you come see us.
I don't want any mutants personally. Okay. So anything else you think people need to know about stem cells?
I just, one thing that I think is so cool is the math about it. So fetuses have what's called a doubling time of 24 hours. So doubling time means how long does it take for a cell to double itself, or a group of cells to double themselves. So it becomes a logarithmic. And that means, like, 1 cell becomes 2 cells, and then they divide into 4 cells, and then 8 cells and 16 cells, and so on. So in a fetus, the doubling time of stem cells are 24 hours. When you're 35 years old, the doubling time is about 48 hours. And by the time you're 65 years old, the doubling time is about 3 days. So what that equates to is that at the end of 30 days, 1 fetal cell, stem cell, will become 1 billion in 30 days. A 35-year-old, because the doubling time is 48 hours, that 1 cell in a 35-year-old will become 32,000 cells. That's very different from 1 billion, isn't it?
Sounds pretty wimpy.
I know. And then when you're 65 and it takes 3 days doubling time for your cells, basically you're going to end up with maybe 200 to 400 cells at the end of that month. So you can see why the more we age, the more wear and tear we get. We just can't keep up with the amount of repair that the body needs. So that's why using younger, robust cells, like we were talking about from Wharton's jelly, are so effective. And one other thing that I didn't mention that stem cells do is they recruit your own stem cells to work better and harder for you, which is just awesome.
Natural state of, not competition, but just rah, go team.
Yeah. Wake up, get to work, right?
Absolutely. Well, I will keep going over patient questions, but I appreciate you clearing up all that information on stem cells or Wharton's jelly.
Okay.
And unless you have anything else, I guess I will talk to you soon.
It's my pleasure. Okay. Talk soon. Let's do lunch.
All right. Sounds good.
All right. Bye.